you today, Mr. Smith? Excellent, excellent. My name is Lauren, and I'm going to be your nurse today. Yes, I will be your admissions nurse. It's wonderful to meet you, too. Please go ahead and have a seat. All right, Mr. Smith. So I'm going to go ahead and ask you just some basic medical history questions. And after I'm done all of my questions, the doctor will be in to speak with you as well. He's going to go over my assessment. He's also going to do your dermatology examination, and he will answer any other questions that you might be having, and also go over any other treatment plans that you might be interested in learning. Does that sound good? Great. And Mr. Smith, can you tell me exactly why we are here today? Okay, you've had some new freckles, some that have changed shape. So you just wanted to get an overall physical and skin assessment? Excellent. We'll be happy to do that for you today. Okay. I'm just going to go over some questions right now. All right. Can you please tell me your full name, Mr. Smith? And what is your date of birth? Happy almost birthday. All right. And what is your current height? And your weight? Excellent. Are you currently in any pain at all, Mr. Smith? No. Excellent. Do you have any allergies that you are aware of? Okay, penicillin. And, sir, what happens when you have penicillin? Gotten some hives? Okay. All right. And where are those freckles that you're wanting us to keep a close eye on? One's on your right upper arm. Oh, you have two on your right upper arm that you want us to look at. Excellent. Okay. And you had a mole removed on your leg before. Which leg? Your right leg as well. Okay. We will keep an eye on how that has been healing over the years. Excellent. Right. And, sir, do you have an advance directive or a living will? Very good. And who is your primary care physician? Very good. Okay. Do you have any other lesions or skin breakdown or easy bruising that we should be aware of? Okay. Any anemias? Excellent. And do you regularly take aspirin products? You do? What dosage? The baby aspirin, the 81 milligrams? Okay. Is that for your heart? Excellent. What other medications do you take, Mr. Smith? You take metoprolol? And what dosage? Okay. Any other medications? Lisinopril? Okay. And the dosage? Did you take these medications today, sir? Okay, very good. And you take metformin? Okay. So you are diabetic. When did you last take your blood sugar? Okay, excellent. It's well controlled? Very good. I'm going to also give you some paperwork on diabetes. We always want to make sure we educate patients so that they can keep themselves in the best health. make sure that you have no other questions about that because it can also affect your skin breakdown. Okay? Great. Okay. Do you smoke, Mr. Smith? Former? Okay. And how long ago did you quit? About 12 years ago? Very good. Proud of you for doing that. How many packs did you smoke a day, Mr. Smith? About half a pack? And for how many years did you smoke? 6 years. And do you drink alcohol? Socially? Excellent. About how many drinks would you say that you have in a week? About 6? Okay. All right. Have you had any recent nausea with vomiting? Good. Any fevers, sore throats? No? Very good. And have you had any surgeries in the past, even going back all the way when you were a baby? You had your tonsils out? Okay, what year was that? Okay, very good. Any other surgeries? Nothing with your eyes, with your appendix? No? Yes, cataract surgery counts. Yes, so you had cataracts in both eyes? Yes, okay. And what year was that? Excellent. Any other surgeries? Okay, very good. Is English your primary and only language? Primary and only, excellent. And what is your family's history with cancer? Have you ever been diagnosed with cancer, Mr. Smith? You have not, but your mother was. She had breast cancer? Okay. Sorry to hear that. I'm glad to hear she's doing all right now, though. Okay. Okay, good for us to know. So your grandfather did have skin cancer. Okay. Alright, well, we're definitely going to want to do a full physical on your skin. I'm going to run through a whole bunch of questions. Just let me know if they apply to you personally, not to the rest of your family, or not. Okay. Great. Alright, we already reviewed your history of allergies early. Have you ever had any ear problems? Okay. Any eye injuries? Not other than the cataract surgery. Good. Do you frequent headaches or migraines? Okay. History of asthma? Sports induced? Okay. Diagnosed when you were a child? Okay. Have you had any recent bronchitis? Any bronchitis in the past? Okay, so none recent, none in the past. Were you diagnosed with COPD? Okay. Recent chronic coughs? Okay. Any history of Alzheimer's? Dizziness or fainting? Some dizziness? Mm-hmm. Okay. Epilepsy or convulsions? Any neuropathies? Have you been educated about neuropathy in regards to your diabetes? You have. Excellent. Okay. Do you have any atrial fibrillation? Okay. Blood clots? Okay. Have you had any heart attacks? Heart murmurs? High cholesterol? Yes. Yeah. All right. Any history of glaucoma? Hearing difficulties? You have trouble hearing out of your left ear? Okay. Do you wear... No? Okay. Have you ever had pneumonia? Okay. Any shortness of breath? Occasionally when you were younger, associated with the asthma? Any tuberculosis? No. Any paralysis? Okay. Have you ever had a stroke? Good. And you have high blood pressure, correct? Yes. I will be getting a set of vital signs after my questionnaire. I will let you know exactly how everything looks with your blood pressure, okay? Great. All right. I want to review your GI. Any history of Crohn's disease? No. Any bowel disease whatsoever? Okay. Have you had any problems with your gallbladder? Oh, it was removed? That's why we do these reviews. Sometimes you forget. And what year was your gallbladder surgery? You don't regularly undergo dialysis? Any kidney disease? You already said no to anemia. Good. No bleeding disorders. Any arthritis? Any back injuries? Any positive diabetes? Any history of reflux? You do reflux, and you don't regularly take anything for that? No? I'm going to give you some information today on reflux, a reflux-friendly diet, and also behavior modifications that you can do to help everything move in the correct direction. Okay. Any recent abdominal pain? Okay. Any history of anxiety or depression? Some anxiety? Okay. And you've not had any cancers? No chemotherapies? Sir, have you had any prostate issues? Okay. Any liver disease or hepatitis? Anything else that you think that we should be aware of medically? No? So you're pretty healthy otherwise? Excellent. Okay. Do you fill that out? I'm just reviewing your paperwork. Fill all that out as well. Very good. You were very thorough in your paperwork at the front desk. Get all of that. So now I just have a couple of more questions in regards more specifically to your skin. Okay. Alright, so we're looking at those mole areas and former biopsy areas you already specified. Have you had any history of contact dermatitis? And you already said that you had the sports-induced asthma. Any atopic dermatitis? Psoriasis? Rashes? Hepatitis C or B? Any HIV or AIDS? Excuse me. Do you regularly use tanning lotions? What about sunscreen? Usually. Not always. It's a little bit difficult sometimes to do it every time we're outside. I try to make a point of carrying a little bit with me at all times, whenever possible, just in case. Okay. And have you had any recent weight loss, Mr. Smith? Any decrease in appetite, anything like that? Increase in tiredness? Just the usual. Yeah, yep, work will do that to you. Excellent, you already told me about your family history, and I have some of that on here in regards to skin issues and skin cancer, so thank you for that, Mr. Smith. Well, that about completes all of the questions that I have for the doctor. So now I just want to go ahead and get some vital signs for you, okay? Excellent. All right. So this instrument here is just a thermometer. It's going to go right across your forehead. Just keep looking forward. Excellent. 97.9 is your temperature. Yes, it is very handy. People are used to the thermometer that goes under their tongue. This one, very, very quick, very efficient, and it gives us accurate information, which is wonderful. This goes right across the forehead, which is really nice. Okay. Now this right here is actually, if I can see your hand, just goes right over top of your finger. It's to get your, yes, it's a pulse oximeter. This is what we use to actually get your heart rate as well as the oxygenation, so we can see how well you're breathing. It analyzes the amount of oxygen in the blood that is circulating. Yes, so you can just relax and sit there. It won't hurt. The last thing I'm going to do is to get your blood pressure, which I know was something you were wanting to check out before. You do regularly you do regularly have high blood pressure, and you take high blood pressure medication, correct? Excellent. And you took it today? Great. How often do you typically check your blood pressure levels? Not as often as you should. Do you have a blood pressure cuff at home? You do not. Okay. I would definitely recommend that you get one. You could get one actually at your local pharmacy. Typically a CVS would carry one. The only thing is typically you need a stethoscope with one of the ones they have, unless you got a more high-tech type. Your other option is just to go to CVS maybe once a week and just use the machine that they have there to test it, just to have a rough idea of where you are. Great. Alright, since the pulse ox is on your left finger, I'm just going to use your right arm, okay? No surgeries, no issues with us taking a blood pressure on that arm, correct? Excellent. Yes, we just have to double check. We want to make sure we're safe, that you didn't forget about anything. Okay, hold that arm out for me. There you go. Just rest your arm down. Very good. Just relax, okay? Just relax. White coat syndrome is definitely a real thing. People come in here and they will get very anxious and nervous just because they are in the presence of a healthcare professional. But please just try to relax. Imagine you're on a beach somewhere, okay? This won't hurt. You will just feel a little bit of squeezing on your arm. is about 135/84. Okay? It's a little bit high. It's not terrible, especially considering you do have high blood pressure and you're probably a little bit nervous just being here at the doctor's office, okay? But again, I highly recommend that you do take care of that. Alright, so I'm just going to go ahead and enter your vital signs that I have into our system, okay? Yes. Yes, so we do have our paper charts so that we can make sure that we have everything documented, and then we will actually scan them into the computer systems. We find that if we are typing on the computer, we don't have that face-to-face interaction with our patients. We don't have as much of that dialogue. So we will enter in some of the more objective clinical documentation, such as vital signs. But when it comes to actually finding out a patient's medical history, which is where we can learn a lot of information, it is much more beneficial for us to have that face-to-face communication that I feel we get more by writing on the charts. As soon as our charts are completed, we actually scan everything into the computer so that all documents are there, and then we use a professional and HIPAA regulated, meaning that we keep everything confidential, company that will shred and recycle that paper. Yes, yes. I know. Documentation is very important. I agree. It definitely takes away from the interaction. Oh, thank you. I definitely like to make a point of actually interacting with my patients. And you've been a wonderful patient today. Yes. I'm just going to finish up this note real fast. Excellent. Your note has been submitted. Thank you very much, Mr. Smith. I now have all of the information for the doctor. The doctor will be in just a few minutes to perform your actual full body skin assessment. He will ask you a few more questions as well, and then ultimately he will review with you his findings and thoughts. He'll let you know if he feels there are any further biopsies which need to be taken. The results of those biopsies will typically come back in about 1 to 2 weeks. So if he does take a biopsy, someone from our facility will get in touch with you by either phone or email. They will let you know if they want you to come back in for another biopsy or anything further at that point. But they will get in touch with you sometime in the next 2 weeks. If no biopsy is taken, that is great news as well. And then you are just free to meet us on the outside there. We will review everything with you before you leave. Okay? Also, the doctor will review with you some other information in regards to the questions that you were asking and the information that you were seeking for today, especially in regards to forehead wrinkles that you indicated on your paperwork, correct? Yes, wonderful. And if you have any other questions, please don't hesitate to ask us. I will also have a packet of paperwork available with our front desk before you head out. Again, please stop in and touch base with her to make sure everything is completed on her end. But I am going to give her some documentation which discusses a little bit more in regards to the reflux you are experiencing so that you can be a bit more educated about that. I'm also going to include some information about diabetes to help make sure we are staying on top of that. Did you want to learn more about also maintaining and regulating your blood pressure? Yes, absolutely. I would be happy to give you some more information in a packet as well. And if you do have any questions about any of those topics, even though we are a dermatology practice, you can feel free to ask the doctor, and he can either refer you or he can give you some further information himself, okay? Excellent. Thank you very much, Mr. Smith. It was a pleasure to have met you today, and I wish you the best of luck. Thank you very much. Have a wonderful rest of your day, Mr. Smith.